Hello, nurses. This is Kevin with nursingcamp.com, and these are my scribble notes. Today I'm focusing on a little bit about medications, how to study for medications and the NCLEX, and how do you dissect that information that you might be having difficulty with in a NCLEX question. So here we go. Here's some basics on this. Now, first thing is we're going to talk about is what I call A-Wales. A-Wales is a technique that I use in order to assess whether or not I understand a medication on all levels. And what I'm talking about is the first question is whether it is acute or chronic. Now, when you're doing NCLEX questions and you have a question and it has a medication in it, and it says like maybe lisinopril, and I don't know what that is, okay? So I have my four squares right here. And what my four squares is a piece of paper that I put beside my questions as I'm doing questions. So as I'm reading questions, in this corner over here, I use content. This corner, I use medications. This corner, I use labs, procedures, um, diets, and contact precautions. And these are just notes. So as I'm going through the question, and I see the word lisinopril, and I'm like, oh, I don't know what that is. Or I know a little bit about it, but I need to look it up. I write lisinopril, and I continue on with my testing banks. Okay. So when I have that word, lisinopril, I know what the medication is, then I do an evaluation of that medication. And the way I do that is with A-Wales. So and how I study it is I do a Socratic method. And the Socratic method means you just don't memorize the content. You approach the content in different ways. And the way I do that is when you're looking at a word like this, Gamic. Okay, well, it spells something, right? Gamic. Well, does that make any sense, right? So I mix the letters around. Macig. Massig? No, that's still not the word. Let me look it again. So I maybe do M-A-G. Oh, it's magic. Now I have the word. Okay, that's a Socratic method. And what I'm basically doing is I keep on flipping the information until I get to the word. Now I have the content. I know how to spell magic. However, in the question, I may be looking at it and it looks like this to me. So I have to move it around until I can see it differently. That's what A-Wales does. A-Wales looks at the information from different perspectives so that you're able to study the content. All right, so let's take the word. Let's take the medication lisinopril. Okay. Now the first thing I do is it acute or is it chronic? I had to figure that out. So I start to study lisinopril, and what I do know about lisinopril is there's ace, king, high. And what that means is that angioedema I look for. They get this weird cough and they get switched to an ARB. And we monitor electrolytes like potassium, high, ace king high. Okay, so I do my research on the medication. I try to learn as much as I can about it. Then I evaluate myself. Well, it's chronic. I don't call the doctor up. And how I decide this is that I decide whether it's acute or chronic. And the way I figure that out is I kind of say, would I call a doctor up at 2 o'clock in the morning for this medication? Or would I not? And why would I call the doctor up at 2 o'clock for medication? Well, generally, I wouldn't call the doctor up at 2 o'clock for lisinopril. But I might call them if I have angioedema. Or maybe if the potassium's high, but most likely it's probably angioedema. They get this annoying cough. I probably won't wake the doctor up in the middle of the night because I know that in the morning they'll just switch the medication to an ARB. Okay, and I'm worried about first dose medication and orthostatic hypotension. All right, so how does it work? That's the next question. Well, it works on the renin-angiotensin system, so I do a little research on that. And I understand that it's the first line defense. It's a first line medication that we give. Okay? So it's more chronic. When do I hold it? Well, if they have angioedema, if they get this cough, maybe if the potassium is high, I'll hold it. What's my assessment? Well, I assess the patients, I assess their blood pressure. How about during? Nothing really. And then post, nothing really. Because it's not really acute. So blood pressure and these things I'm looking for. Next, L, labs. Any labs associated with ACE inhibitors. Yeah, potassium. So I might assess the potassium levels, but I mainly worry about it being high. And that would be other symptoms like patient has on lisinopril and has peak T waves. Well, that's because of the high potassium, and the lisinopril might be causing it. Okay. Next thing is eating. Does it affect their eating? Not really for ACE inhibitors. Oh, but in my research, I might have realized that captopril does affect, because it gives them bad taste in their mouth when they take captopril. That's why I call it craptopril. So when they have that medication, they have a bad taste. So they can take this with food. And I would have gotten that from that food. If I didn't know there was any eating, I would do some more research. Oh, wow, look at that. Captopril has problems with bad taste in their mouth. And then I evaluate it. Then the last thing is I sit back and I say to myself, what stands out with this medication? And that's the S. Well, angioedema, ACE, the cough, the electrolyte potassium high, craptopril, and orthostatic hypotension. These are probably things I would watch for and assess for. That's my AWALS method to evaluate medications. When you are studying for your NCLEX or studying for your test, and when you're evaluating, do I truly know the medication from all different areas versus just the memorization? But ask yourself these questions. And hopefully that helps, and that's the way that we'll look at our medications and as we continually evaluate. That's it. My name is Nursing Camp, and you can see me at nursingcamp.com. I'm on Instagram. I'm on Facebook, Pinterest, and Etsy as well. My study sheets are available for free download, or you can join nursingcamp.com, where I give you free badges, free books, and stuff like that, where I make resources for that nurse. And nurse on. We'll see you next time.